Hello, welcome parents. My name is Sonu Sanghoee. I'm the clinical director at Achieve Beyond and a speech pathologist. Today, I would like to share some tips, ideas, and strategies for feeding and provide you with some helpful guide that you can carry over at home with your kiddos. Before we begin intervention techniques and strategies, let's take a look at the stages of development. This is one of my favorite charts that I would like to share with you. So let's take a look at the first one. So birth to 4 months. Kiddos, like around birth to 3 months, start developing or have gained very good head control. Some children between 3 to 4 months start also sitting up with support. So if you look at the motor skills, head control is acquired by birth to 4 months, and the most type of progression of the food type is mostly liquid. But around 4 months, some kids start also probably suckling off from a spoon and accepting purees, maybe a small one bite. So the motor skills, because the head control is now being acquired, some kids are beginning to sit up with support so they can start probably holding up the bottle with support and suckle off from a spoon. So if you take a look at the second one, 4 to 6 months, purees, because let's take a look at the motor skills, there is better sitting balance. As I said, they begin to sit up with support, right? And if you take a look at their play, they start putting everything in the mouth because they're exploring. So they're bringing their hands to the mouth. So look at the purees, they're suckling off from the spoon. And some kiddos might even, if you touch their, probably support their elbow, they might even want to touch the spoon themselves. So motor skills, oral motor skills, the type of foods are all tied in together. That's why I was saying this chart is like really very good to use. Let's go to the next one, 6 to 9 months. And this one is also one of my favorite times, 6 to 9 months, because oftentimes parents and even us professionals, we tend to probably be a little bit, off the fence, a little bit more cautious in terms of giving children different textures. But if you take a look at this chart, let's take a look at the motor skills, right? Now, starting from 6 months on to 6 to 9 months, they start to probably hold and grab things. They're putting things in the mouth, but more thing is about grabbing. And some kids want to put up like with their fingers, right? And the teeth start coming in. So take a look at the type of food. From purees, we have soft chewable that we have progressed to. Because the teeth is coming in, they want to nibble and they want to chew on something. And from your experience, if your child 8, 9 months, if you put a finger in their mouth, the first thing is to bite, right? Because they have teeth in there. So they're telling you, the skills are telling you, they're ready to take a softer texture where they can nibble and bite on. But feeding being so emotional, as I said, we are so cautious. So we don't introduce those soft chewables at the time, thinking they might choke or they may not be able to tolerate that. So we tend to get into more liquids and purees. So what we have done in that time is limited the exposure for the children. So feeding as much as like a learned phenomena, exposure is the key for children. And that's the reason I wanted to show you this chart, how the motor skills in the developmental stages are tied into types of foods the children are going to accept. So this is one of the good charts I wanted to share. And even take a look at the assisted cup drinking. We don't introduce cups because in the fear of it's going to spill, they will not be able to do it. And we keep on continuing with bottles and nipples and replace the bottles with sippy cups. But the kids are ready to take a cup. Again, I'm not saying an open cup, but maybe a cup with a straw. As a speech pathologist, as I was talking to you about sippy cups and bottles and nipples, those bottles and nipples for infants are great. But if we are going to continue with the small spouts and pouts, we are going to automatically make the children's mouths going pouting, and the teeth, they could be underjetted or overjetted. So it is not recommended to use that open mouth or a spouty cup. So replace with a cup with a straw. So that is where children's motor skills are also tied in together. And if we take a look at the next stage, 9 to 12 months, look at the type of food progression already that we can start introducing to children is ground soft foods, lumpy purees, has a little bit of a texture in there, so that we are providing them with some sensory input for them to be able to move their tongues and start to nibble on it. Because with their motor development already, they have teeth, right? And they are looking for that sensory input in the mouth to be able to bite and chew. So if we are going to deprive them from that, we have, again, made a small pocket of less exposure for them. So that gap, we will have to go back and bridge, and then that gap is going to increase. So if you take a look at the next one, 12 to 18 months, look at that, all textures. Again, not at 12 months, but that is a very big window because a lot of motor skills are developing. Children are able to stand up with support. Some children start at 12 months, start walking. They are able to walk fast. Their hands, their eye-hand coordination, their grasping skills are all increasing so much. So that is giving them more movement options. So they're exploring. They are craving to explore newer textures, newer taste, and newer things, right? So look at that. That's why I'm saying 12 to 18, all textures. Around 14, 15 months, they can start accepting all textures. Again, not like harder meats, but actually softer foods, cut out small slices. So that's why 12 to 18, all textures. And if you take a look at it, straw drinking, and look in terms of the type of chewing, they are able to do more. First, in the beginning stages, from 6 to 9 months, they're nibbling like a squirrel, up and down. And chewing progresses from the midline to the side. So they start using up and down, biting, up and down nibbling, and then they go down to more diagonal and rotary chew because the molars are big, or premolars are beginning to appear, and they're craving more input for their gums. So that is just naturally tied into the progression. The next one is positioning and seating is also an important aspect. Again, it does not mean that you have to go back and buy high chairs and you have to go and buy a certain place, but the key is to be consistent. Key is to make sure the children are seated safely and efficiently. So why that positioning? Positioning only does not mean seating. The kid might be a kid one, and you might be a kiddo, and you're holding them in your lap and you're cradling them. That also is positioning. But the efficient positioning is what I am talking about. It is important in terms of safety. So increases efficiency of feedings, the oral intake, they are going to be more interactive, and more oral intake will happen. Digestion of foods and liquids becomes more easier, more trunk and posture stability. And the last few ones which I really like and which we don't give too much of importance to is enjoyment during feeding and interaction. Feeding is emotional and a learned behavior. As I said, if it is going to be pleasurable, it's going to be remembered. So that's the enjoyment and the interaction during feeding time. So if you have better positioning and seating, if we are comfortable, everything looks great. So just wanted to share that effective positioning is very important. If children who have certain motor concerns is also important because it helps to breathe better. The food is controlled better and will be transported to the food pipe instead of going into the windpipe, and where the children are having some coughing episodes. So professionally, that is important too. The general goal is to establish central alignment and being stable and safe for feeding. So that is just a general rule of thumb that you should remember. So just a simple thing, this picture says it all. A feeding posture, like again, you as parents are more experienced, but I just wanted to share and show you. Looks like a very simple picture in terms of when you're cradling the child and holding, but just take a look at it. The child's head is not totally flat. You're holding them at a slight 45-degree angle where the head is supported, and that's important. At this stage, when children are infants, their larynx or the windpipe is more straighter. So you really want to make it curved. As we grow older, it becomes curved, like an S-shaped. But when they are kids, it's more straight. So you definitely want to hold them at an angle. So that was the reason I wanted to share this picture with you. The next one is the sitting posture, and I'll go into the next slide where we talk a little bit about just showing you this. If you don't have a chair, no matter, no problem. We can sit at the back of the couch, just making sure. The first thing is, even more than the hips, the trunk control. The trunk has to be straight. That you really want to make sure of that. If the child wants to sit on the floor, no problem. Just make sure the trunk support is the key and the hips are stabilized. If there is a chair, hip position at 90 degrees, trunk is upright. So now children are older, so they're grown up. So now the larynx is getting curved. So they need to be at a straight angle, not at a 45-degree angle, more at 90 degrees. But if there are other motor concerns as recommended by a speech pathologist or an occupational therapist or a physical therapist, follow those guidelines. But this is for typically developing children. So that's what I was talking about. So making sure shoulders are facing forward. So if the shoulders are facing forward, automatically your trunk is upright. So just wanted to give you that pointers. If there is a chair, make sure there is some support for the foot as well. If there is a tray, the elbow rests well on the tray. So that was his thing. But again, if the hands are moving, is fine too. But the main thing is they should not be wobbly. If they are, support them with pillows, rolled up pillows, or some long towels, rolled up towels too, just making sure that they are stable. So that's the reason I wanted to share this with you. So now so that was just some guide in terms of stages of development, how motor development is tied into different stages and positioning. We'll talk a little bit about intervention at home, like you can do things at home. So I always say, let's start taking some data, like, okay, it's not like you are going to become data scientists and saying, oh, you are going to give me so much of work. No, it's not that. You are the parents, you interact with the children on a daily basis. The reason I'm saying is to take data is to begin small. We can take one component at a time and start to change. Because feeding, as parents, what do you want? You want your child to be well fed and well taken care of. And absolutely, that's our goal as well. So, but with that information, think about it. It's such a loaded statement, right? I want them to be well fed. It's so much of emotions in there as well, right? So we would not give it a thought, but we might be changing so many components in order to give the best to the child, and that might be start confusing for the kiddo. So it's much better to start small. That's the reason I was talking about data collection. It's just data collection. The fancy or easy word is having a food diary, knowing what is the child's preference, what does he like, and just keeping that. Maybe keep like a 5-day baseline and try to get that. Sometimes you may not find, oh, this is the one. You might have 2-3 things in there, but we can pick up, okay, out of those 2-3 things, which is the most preferable, which is the one preferable, and how I can go into the stages. So that was the reason about the data collection. It'll give you preferred textures, temperatures, and tastes. We don't focus so much on the taste and temperature. I'll go into it later. And I'll tell you why it will be important. And also for you to know, is the child eating chewable foods or smoother foods or only taking purees? And as the chart that I showed you earlier, they might be ready to take on soft chewables, right? So how can we get back and grade those textures. But the child is still doing infantile sucking. Are we only giving them bottles or nipples? Can we go and progress to probably a cup with a straw where we can give them a little bit more movement option? So this will give you a little idea. And that's like, now let's begin intervention, give you some strategies and tips. So the 3 T's of feeding intervention is what I like. I always say 3 T's: taste, temperature, and texture. Texture is the one that we focus a lot on. We don't focus a lot for children on taste and temperature, but it's like some small thing just for you to know. Sometimes changing the taste can make things so much better. If we change the temperature, the texture automatically could change, right? So let's take an example. There might be, we all like usually cold milk on cereal. Why? They're crunchy. But there might be a child where he's taking not so cold milk, like warm milk on cold cereal. So that becomes very mushy. For some time, child might do it, but it may not be so pleasurable or palatable for the kid. But it also could be when we want to introduce a crunchy food, child may not know what to do with that, right? So he does not know what, to swallow. They know, but they just may not know what is happening in the mouth, which they have never tasted. So if we change the temperature a little bit, that texture could automatically change. Ice cream, there might be a kid like, okay, well, he likes to eat, like not thinking, doesn't like cold foods. Okay, well, when I gave him ice cream, the child just had an overreaction, did not know what to do. Because usually when we give maybe yogurt or ice cream at home, we leave it on the counter for 5-10 minutes and it becomes a little bit more smoother, maybe more milky, but it is more warmer. It's not cold. So they may not know how to handle that. So therefore, I will say experiment with temperature, cold, warm. So that will be a good one to also go. Instead of changing the texture right away, we can just change that temperature. The next is taste. As I said, from my experience that I'm sharing, I'm not saying that you are not aware of, but in my experience, usually that I found is that taste is what that we don't, even the professionals, we don't focus so much on that, right? Sometimes thinking with children may have an overreaction if we add certain kind of a flavor to the food. Children are very curious from nature, right? They want to get something new. Children across the world, based on different cultures, where they're coming from, the foods, the tastes are so different. Children are able to handle it. But if we keep them away from that for a long time and we introduce it the first time, the reaction could be very different. So we need to go in gradual steps. So children may, like for example, like they have, start with small amounts of foods with probably unfamiliar taste. They can start with smelling and then licking, and then gradually add that every day in like maybe two bites of that food every day in their during their lunchtime or their snack time. For children who are hyposensitive, maybe perking up the foods. If their reactions are underreactions, so maybe perking up the food and adding a little bit herb, maybe a lemon, maybe like ketchup, I know we want the children not to start taking junk food, but what I mean to say is perking up the food with certain flavor. That is also very good. And if you take a look at some of this baby foods, Gerber, you will see, if you go onto their website or if you're aware of, you will even see at different stages, they have children's developmental milestones saying supported sitter. And there are options of foods with different tastes they list, right? So that means children are able to handle that. So that is, again, just a reminder that, yes, we can do that for the kids. For hypersensitive children, maybe we want to use some milder flavors. So just to be aware of that. The third T is the texture. I think everybody is very aware of the texture, what to do with that. But the reason I'm talking about texture over here is, for example, this is again from my common experience that I have found there might be kiddos in the families where the children are taking smoother foods, pureed foods, and milk and juice. And now the child is 18 months of age, and we are thinking, oh, well, he doesn't eat any crunchy foods, doesn't eat any harder foods. So now the child is taking only exposed to pureed and smoother foods, right? If we are going to right away come back and introduce slices of apple, slices of chicken, the child may spit it out. Not that they do not know how to bite and chew, but we have left them not given that exposure. So we may have to go back and grade, something I'm calling grade the textures. So like children is taking purees, maybe we go back and add lumpy purees, maybe we go to ground texture, give them soft chewables, and then we go into apple slices. So we are going in progression so that they are getting that grading of textures. So that's one common mistake I usually find even the professionals and some parents would do it. Not that they do not know, it's just like, yeah, developmentally they should be eating that. And all of a sudden the child does not know how to handle that. So that was just a caution in here, and thinking that that's the reason I want to come back and saying grade those textures. So this is a nice little slide to take a look at it. We have liquids the child might be taking, smooth purees, go lumpy puree, make it mushy, then add softer foods, then go to ground, come to firmer foods, and then crunchy, hard and mixed. So even if the big child is 18 months, 20 months, or 24 months, but all they do is take milk and purees, we can start, instead of going to crunchy, we know that should be taking crunchy hard, we should start going in progress. Like add lumpy puree, start giving oatmeals, maybe softer pears, small bites of peaches, and then you go into ground chopped and then let them bite on cheese string. So that is the reason I wanted to share this with you. Another approach that I really want to talk to you about, I call successive approximation or sensory approach. And this works for any kids. It was like grading the textures. There might be a kid who's we call picky eater. They don't want to eat this food. And we have been trying this, and then we have given up. So successive approximation is where we meet the child where they are at, right? And we start in smaller steps. So I call it like a TSKLB sequence. Start with having them touch the food, then smell the food, then kiss the food, then lick the food, and then bite it. So the focus is shifted off, okay, this is the food you want to try, and you want them to take a bite right away. It may not happen. Start with that touching, smelling, licking, and then going to take a bite, and reinforce each of that sequence. It really works very well. This is another thing I wanted to talk to you about, the food chaining and linking to learn. So let's take a look at this example, right? There might be a kid that you have, or one of my cousin's friend, his son, it only takes applesauce from a pouch. So they were like struggling to give him anything else. So I said, okay, how about we chain it? So applesauce from a pouch, we keep the applesauce consistent. Maybe we can give 2 bites and present it in a bowl, a nice looking bowl with a cartoon character. Take it with a spoon, reinforce that, then progress to applesauce with some diced apples, and then you can have the cut up apples. So it's just going in smaller step and linking in with what they'd like. French fries. How much of us love French fries from the restaurant? So maybe going with baked fries at home, adding maybe sweet potato fries, then adding potato wedges, and then probably eventually going to baked potato. Chicken nuggets from a restaurant, start off with chicken nuggets baked at home, and you can have a similar shape. Next one, you can have a different shape, and then you can have probably progress to fish sticks and then to go to baked fish. Let's take a look at these two examples. Apple being in the middle. So you start with the favorite food, change the shape, change the temperature, change the texture, change the taste and flavor, and change the color. So let's say you come back and say, does not like, just only wants to eat apple slices. So how are we going to increase that apple slices exposure to different things? So let's keep the apple slices. Maybe we can cut those apple slices into a fun shape, maybe a star shape, maybe a moon shape. You change the visual presentation, change the shape. Apple slices, baked apples, warm apples. You change the temperature and change the flavor. Next one could be changing the texture, freeze-dried apple slices. Then changing the taste and flavor, sprinkle it with cinnamon. Simple thing could be changing different, having Granny Smith apple, golden delicious. You can just change the color of the apple. So just with the apple, you have increased the child's repertoire. So that is food chaining. I was talking to you about the bottle with a straw. This is a very good one. Instead of progressing directly from giving children bottles and sippy cups, instead of going to an open cup, start off at around 9 months, 10 months, when they are standing up with support. By 12 months, when they are walking, they have so much movement options. Replace your sippy cups with this honey bear bottle. And see, there's a straw over there. You can adjust the height of the straw. And the main thing is the child can control how much liquid comes out. They squeeze the belly and that much liquid comes out, and you can even close the straw there. So this is a very good one, transitioning from your baby bottles, sippy cups, to honey bear bottle. And then next step is using a sip tip cup. This is a great one too. And these are not very expensive at all. They are very, very easy to order on Amazon, like maybe $8 to $10 maybe. There is a hole on the lid here. When you press that hole, the amount of liquid that comes up can be controlled. So that is the amount of liquid the child will have. If the kids have problem with jetting out the tongue and protruding the tongue, the small cover, which is on the straw, stays on the lips and protects the tongue from jetting out. So this is also a very good one to go in to transition to a open cup. The other website that I really wanted to share was ChooseMyPlate.gov. You can go back and play around, started by Michelle Obama. It has very nice free articles on printing out printables, how to have children be your helper in the kitchen. So they have very fun ideas in there. So this is a very good one. And last but not the least, this chewing mesh. This looks very babyish, right? But take a look at this picture. Instead of giving children nipples during the day to suck on, as I said earlier on, nipples by sucking on make the mouth spout. This infant feeder, the child can hold on. You can put in pears, peaches, whatever you want to do. So they're able to bite, they're able to chew, and they can hold it. And they can tone their muscles. So you've given them more movement option instead of having them suck on a nipple and give that mouth becoming more pouty. And that's it from me. Thank you.